Welcome into the live desk. My name is Janae Hancock here inside of the KCTV5 newsroom. The good thing is that we made it to Friday. It is December 1st, but it is also World AIDS Day. And with that being said, I do want to bring in our guest for today. You're taking a look at Kimberly Carlson. She is the president of AIDS Service Foundation of Greater Kansas City. And Kimberly, I want to thank you so much for joining me here at the live desk. I know you've had a busy morning this morning, and you also had a busy night last night with all of the events going on regarding World AIDS Day. So what is the importance of today?
Hi, good morning, Janae. Thank you for having me. World AIDS Day has been commemorated since 1988, so 35 years on December 1st. We always pause to remember those lost to HIV/AIDS and related conditions. In the early days before effective medication was widely available, so many lives were lost too soon due to the virus. So we always remember those individuals, the lives they led, their presence, their spirit, and just take time to miss them. Also, World AIDS Day, our theme this year is Remember, Celebrate, and Hope. So in addition to remembering those individuals, we celebrate the achievements and progress that we have made since the early days of the epidemic. We have effective medication to prevent and treat HIV now. And then we also look with hope towards a day in the future where we have an effective HIV vaccine and where there is equitable access to prevention and treatment for whole person wellness to support people living with HIV and those at risk with HIV as well.
Remember, celebrate, and hope. And I think that's so important because there is such a stigma behind HIV/AIDS. I do want to focus on here locally. What are the statistics looking like today?
Sure. So in 2022, there were a little bit more than 5,800 persons living with HIV in the 7-county Kansas City metro area community. There are on average around 200 new diagnoses a year. But what is also very important is of the cases, approximately 13% of those living with HIV are not aware that they are carrying the virus because they have not been tested. So the Centers for Disease Control and Prevention recommends that all people aged 13 to 64 be tested at least once in their life. But this is not something that most people are doing. So we encourage you, if you've never been tested for HIV, to ask your general practitioner. There's over-the-counter tests. You can get free tests by mail now through a new national initiative called Take Two Together at home, where they mail you 2 oral swab tests every 90 days, if you wish. And then there's over-the-counter tests as well at every pharmacy.
And you know what I think is also so interesting, as we throw out those numbers, you touched on the fact that 13% of the people, the population, they don't know that they may have this. But also what I thought was so interesting this morning, what I learned is that people at the age of 13, that's when they recommend that you start getting tested, the CDC, is that correct?
Correct.
And has that always been a thing?
I mean, it's important to acknowledge that persons that young are engaged in sexual behavior. So acknowledging that and knowledge of your status is power, because if persons are positive for HIV, they can get into appropriate medical care quickly and keep the virus under control. So a lot of people may not know that there is a scientific fact called undetectable means untransmittable. Research has proven, and this is internationally and nationally accepted by all major health organizations, if persons living with HIV are taking their HIV medication consistently to the point where virus is not detectable in their blood, they have zero risk of passing on the virus sexually. Zero risk. So this was a game changer for people living with HIV to not feel that they are infectious or at risk to passing on the virus if they're caring for themselves, engaged in care, and taking their medication as directed. With younger people, what we're seeing of those 5,800 living in with HIV in the Kansas City area, about 33% of those persons are between ages 25 and 34. So there are younger people living with and being diagnosed with the virus in our metro area.
I think you touched on a very important point there when you said knowledge of your status is very important. So it's better to know than to not know. And starting at the age of 13, going up until the age of 64, how can the community help out? How can they spread the word or learn more information?
I think acknowledging that HIV is still here. Like I said, almost 6,000 residents of the metro area are still living with HIV. So a lot of people think that it's an issue of the past, but it remains a pertinent issue today. Also recognizing that it is related to health inequities and health disparities. So we're seeing about 5 times as many new infections in Black and African American communities, and compared to whites, and about 3 times as many in the Latino community compared to white people. So just spreading evidence-based information about how and when to get tested. And then also that there is prevention medication out there. It's called pre-exposure prophylaxis. So either a daily pill or an injection administered by a healthcare professional every 2 months that can be up to 99% effective at preventing HIV. So these are powerful tools. Although we don't have a vaccine, we have medication that is available to prevent HIV for people that are HIV negative and for people that are living with HIV to stop the spread of the virus by taking their medication as directed. So we have these effective tools to end the epidemic.
And you also touched on the fact that this is more common, obviously, like several other situations in disorders, I should say, that it's more common among minorities. Do we know exactly why that is and if that is going to continue for the next future generations?
Unfortunately, many health conditions seem to be closely related to social determinants of health. And what we offer through funding through the AIDS Service Foundation is a comprehensive approach to fund nonprofits all throughout the Kansas City metro area that are not only treating medical care for people living with HIV, but also helping provide safe and supportive housing, mental health and wellness, substance use services such as Narcan provision. People are multidimensional and dealing with so many different things in their lives, and they need a safety net of support that is lifting them up in a multitude of ways to support all the different aspects of their life so they can be healthy and well and thriving as individuals.
Kimberly, I want to thank you so much for joining me here at the Live Desk. But before I let you go this morning, is there anything else that you would like to add on to this interview that our viewers need to know?
Just always remember that World AIDS Day is December 1st. So take a moment to reflect on HIV and persons that have been lost to that, and save the date for Saturday, April 27th, our 36th annual AIDS Walk. We'd love to see you there.
Perfect. A great community effort there. Thank you so much, Kimberly, for joining me. I am going to take a live look over the plaza. It's very gloomy out there. We are looking ahead to our noon newscast, so be sure to tune in to that. And also be sure to keep in mind today is December 1st, but it is also World AIDS Day, and we are remembering all of the people that we have lost and all the people who are currently suffering. Remember, celebrate, and hope. Thank you so much, Kimberly.